Any amendments to the agenda, Dr. Young?
No, Madam Chair.
All right, we will open it up to public comment. Comments will be limited to 3 minutes per person in order to afford everyone an opportunity to speak. If comments relate to a specific public hearing item, we ask that you offer these comments at the time of the public hearing. Do we have any email response, people in the boardroom, or anybody online who would like to give public comment?
Madam Chair, we don't have anyone in the boardroom, but I did receive correspondence via email. The correspondence is from Kathy Dyson of the Freelance Star. She asked that someone please read this question during the public comment tonight. 4 of the 9 deaths from COVID-19 in the Rappahannock Area Health District were King George residents, and there were more from King George than any other locality in the district. Spotsylvania County has had 3 deaths and Stafford County 2 deaths. I hope board members can offer comments or any perspective on these deaths. Thank you and stay safe. Kathy Dyson.
Thank you, Dr. Young. Did anybody else have any correspondence? Guess that would be no. So we will move on to reports from members of the board. Mr. Stonehill, since you're online, you go first.
All right, outside of talking to a number of constituents and people asking questions, Wednesday the 8th, I, along with everybody else, attended our next budget work session here for the county. Wednesday the 15th, I called in and jumped on the phone conference from Rob Whitman's office for more news of what's going on from the DC side and locally through our area about the COVID outbreak. That evening, I also attended another county budget work session via computer. Thursday the 16th, I logged on to Murray Washington's Facebook page and watched their town hall meeting when they spoke about more pertinent information about the COVID virus, clinical info, and more of community resources that are available for the public. And just wanted to say my thoughts and condolences go out to our community for people who have lost loved ones to this virus and other related issues. And seems like we're getting more and more of those. So that's it. Very short for me.
Thank you, Mr. Stonehill. Ms. Kupka.
Yes, ma'am. Before mentioning my recent activities, I'd like to shine a spotlight in honor of National Library Week, April 19th to 25th, on a county department that, just like all of our other departments, has continued to provide services to our community despite its closure. It's Smoot Library. Our library never missed a beat. Since beginning curbside pickup on March 17th, our library staff have provided over 400 pickups of more than 2,576 items. That's data as of Friday, April 17th. The total circulation for the month was 9,079 items, including digital resources and renewals. In addition to library materials, they are also distributing tax forms, craft kits, census promotional items, and starting today can make available the Garden Club of Virginia Historic Garden Week 2020 commemorative booklet if you request it. Many other libraries in our region are closed. We are fortunate to have a local small town library that can sustain providing services to our citizens given the circumstances. Thank you to our library director and staff for all they're doing. I mentioned Garden Week. Today, we would have celebrated our 300 years by visiting 5 historic properties and St. Paul's Church during the Garden Week tour. I want to thank the owners of those properties for volunteering for the tour, even though it didn't come to fruition this year. I hope you will consider participating next year. If you all haven't seen the booklet yet, you can request a copy from the library. It really would have been a spectacular event. April 8th and 15th, attended the county budget work sessions. Thank you to county staff for your hard work as we continue our budget process. And thank you to all of the county department directors who have taken pains to cut their budget back as much as possible given the revenue shortfalls we are anticipating. Monday, April 13th, participated in a conference call for planning districts with Senator Tim Kaine at the invitation of George Washington Regional Commission. It has been noted on the federal level how important broadband access is, like we've been saying here in King George for years, to rural communities like ours when online working, learning, and healthcare strategies have to be implemented broadly, and hopefully the funding for that follows. Thursday, April 16th, the Mary Washington Hospital online town hall. Friday, April 17th, participated in a conference call for elected officials hosted by Congressman Rob Whitman. I asked 4 questions during the call, and I'll briefly summarize the answers here. Number 1, COVID-19 case recovery data intentionally was not built into the VDH website in order to make the public cognizant of the severity of the situation. I was told if you want information regarding recovery data, to scroll to the bottom of the COVID-19 page on Virginia Department of Health website and click on the link for the VHHA dashboard. They are reporting some recovery statistics there. Number 2, funds for the Paycheck Protection Program ran out fairly quickly. There is a plan in the works to issue more funding in another round of stimulus bills. Number 3, the Nice Bridge project is still on track and has not been affected. And number 4, federal funds allocated to Virginia will be dispersed based on percentage of population, not based on severity of outbreak in individual localities. So that's good news for us. It'll be distributed fairly based on population. To our first responders, healthcare workers, grocery and pharmacy workers, thank you again for putting yourselves in harm's way to make sure our basic needs continue to be met. To our community, please keep doing what you're doing to care for yourselves and your families and get fresh air and exercise following the social distancing guidelines to stay healthy. Please stay at home unless you need food, medicine, or necessary supplies or an essential worker per the governor's order. Do what you can to check in on your neighbors and friends. We have had 4 of our elderly citizens succumb to disease. Each of them was someone important to someone else in our community, whether that be a parent, grandparent, spouse, friend, etc. They are why we've been asked to stay home when we can. Some of you are frightened. Some of you are angry. I understand that. All of these reactions are real, and they vary from person to person. Please remember, we are all in this together, and we need to work together to get through this. I have been inspired by the many groups of citizens doing what they can to help their fellow man. Individuals and groups have sewn mass quantities of masks, provided meals to our first responders. Nonprofits have provided childcare at no charge to medical personnel, provided school supplies to our students learning from home, and provided drive-through food bank services to those in need. That's the caring community that is King George County. Thank you again to all of you in our community for the opportunity to serve you. Please don't hesitate to contact me with your cares and concerns for our community. Thank you.
Thank you, Ms. Kupka. Mr. Bush.
Thank you, Madam Chair. On the 8th and the 15th, I also attended the budget work sessions that we held. And yesterday evening, I followed the school board's meeting very closely online. With that, I'd like to say that fear is being utilized here from a virus that has affected 0.12% of the Commonwealth's population. Of that percentage, which is based off of cumulative numbers from the first positive test of a Marine at Fort Belvoir on March 7th, I can't seem to get a straight answer on recoveries or even what are no longer active cases from the Virginia Department of Health. They don't seem to like the word recovery. Meanwhile, 100% of the Commonwealth of Virginia is affected by these orders. With that, some are saying that this is a new normal. I don't agree with that statement at all. I think it's time to get back to normal. It's time to make serious plans, not an overnight reaction, but to make plans to reopen Virginia, to get to work on addressing the ultimate recession we are facing that will touch every single Virginia household. With that, to Ms. Kathy Dyson's question that Dr. Young read earlier, it is heartbreaking that people's passing, elderly, if COVID-19 contributed to their deaths, it's heartbreaking. But COVID is not the single factor in some of the deaths that are being reported by the Virginia Department of Health. There are other mitigating circumstances, pre-existing conditions that also go in line with that. I seriously question the numbers that are coming out of the Virginia Department of Health. And until they find a point where they can be truly transparent, I'm giving very little credibility, as far as myself, towards the numbers that they're reporting. Thank you, Madam Chair. That concludes my report.
Thank you, Mr. Bush. Mr. Granger.
Yes, ma'am. Thank you. I also attended the budget work sessions on the 8th and the 15th. I'd like to say thank you to staff for finding a way to tighten belts. We definitely have a challenging year coming up, and I appreciate their frugalness in finding what the bare minimum is they need in order to continue operations. And I'm sure the citizens as well appreciate their frugalness. So thank you to staff for that. Other than that, I'd like to say I had correspondence from Mr. Clark, the Parks and Rec, head of Parks and Rec, and he's also leading up the King George Census Complete Count Committee. He let me know that we are currently at 58.1% of the people in the county have responded and given their information. So that's of the households. And I'd just like to encourage all people, if you have the opportunity and the means, to please go online. That's the easiest way if you have internet connectivity. I know there's a number of people who don't, but it is my2020census.gov. And if you don't have internet connectivity, if you have a trusted friend or a relative who you could have maybe help you if they do have connectivity, please reach out to them as well, with keeping in mind social distancing and all of those regulations in place. I don't want anyone to endanger themselves, but this is also an important activity to get done as well. With all that said, census workers will start field operations beginning June 13th. It's been pushed back, I believe, from the original date. I don't recall what the original date was off the top of my head, but so if for those people who have not responded, starting that date, there'll be people in the field who'll be going around to houses to try to collect that data, which is, as I said, very important. Other than that, I'd just like to say I keep in all the people who are impacted by what's going on in my prayers, which I believe everyone, whether it's illness or the shutdown and financial situations. So they're all in my mind. And so just like to say that. Thank you.
Thank you, Mr. Granger. I'm going to touch on a couple things before the board report that I had already prepared. To question for Ms. Dyson, my condolences do go out to all those in the community that have lost loved ones and are affected by COVID-19 as it touches King George. And that also goes to King George residents that might have had family members or friends outside of the area that have been touched by this disease. On our county website, I had asked Dr. Young last week to make the information more accessible, so especially older residents or people not as familiar with our website can find the information on COVID a little easier. And I thank you, Dr. Young, and the IT staff for anybody else involved in that for making that possible. People can, I think, can read it a little more easier now, and I really appreciate you doing that for our citizens. Ms. Kupska mentioned the GWRC call, and I asked Senator Kane on that call about our broadband and that I was appreciative that he was addressing it because a lot of people think that King George is covered because we're so close to DC and Fredericksburg, and people don't realize that we're really underserved with broadband. I mean, myself included. And I just want to get it out there that people understand that we are not served in we really need help with broadband. And I did appreciate him acknowledging that. He mentioned us by name and mentioned Dahlgren. As a member of the Smoot Library Board of Trustees, I want to say Happy Library Workers Day. Ms. Kupka kind of stole my thunder with all that information, but I really appreciate Robin and her team for the plan they came up with just before the COVID-19 break, and I really appreciate all they've done servicing the citizens. I know everyone that utilizes our really, truly community library appreciates her and her staff for all they're doing to try to help people out in this time to read a book or get a whatever they need to do. I really appreciate her and her staff. Now I'm going to read my board report that I prepared. I want to start off by thanking each and every King George resident that is making a difference in this community. What you do on a day-to-day basis, whether as a first responder, law enforcement, healthcare provider, school personnel, volunteer, and maybe just checking in on your neighbor. Thank you for serving the citizens of King George. These are challenging times, and with it comes hard choices that not only the government, businesses, or local residents need to make on a day-to-day basis, and it is very challenging. With the ever-changing information, we all need to work together to make the best decisions possible. Though not always popular, they are made with great thought and attention. Each member of our board participates on numerous teleconferences with state and federal representatives on a weekly basis. With added input from our county staff and administration, we move forward heading to a goal of reopening our community in a safe and planned manner. With this in mind, I will host a virtual town hall next Wednesday, April 29th at 6 p.m. It will last 1 hour, and information to tune into the Shiloh Town Hall, as I'm calling it, with GoToMeeting, which those that are online now using GoToMeeting might know, or you can get access the information on the county website on my Twitter page that I started, which is @KathyShiloh. That's @KathyShiloh. Or my colleagues, I sent it to earlier. If you could put that on your social media accounts to get the link, I would truly appreciate that. And I want to thank our IT director, Chris Dines, for helping me out with this today. And I look forward to seeing you next Wednesday to hear your concerns and positive stories of how King George is weathering the COVID storm. And I appreciate serving not only my constituents of the Shiloh district, but all of the King George County as the 2020 chairwoman of the Board of Supervisors. And I hope to see you online next Wednesday. Thank you. With that, I move to the consent agenda. Do I have a motion?
Move to accept as presented.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Any nays? Chair votes aye, motion carries. We move now to the county officials' reports, constitutional officers.
No report, Madam Chair.
All right, thank you. Report of the county attorney.
Thank you, Madam Chair. As you know, I've been working with county administrator and a lot of the other county staff, Chief Moody and the sheriff and others, in order to weather the storm, as you correctly put it, of the pandemic. And that's taken up most of everybody's time, I think, both in thoughts and in deeds. We have also had the regular county business that is going on. We've updated the county contracts. I've worked with the purchasing agent to do that for a general services agreement and the construction services and professional services agreement. We entered into a bunch of other contracts related to COVID, including trying to obtain additional masks and PPE for the first responders. I'm also in the process, as you know, of collecting the various board manuals and bylaws and procedures and make sure that they're in good stead. We have many of them, as you know, from the EDA to the landfill to the tourism. There's just many, many boards. So I'll be working with county administrator and staff in order to get those going. We've also been going over the copious and ever-changing advice from DOL, CDC, and the various EEOC agencies regarding the pandemic and the effect that it may have on workers of the county. There's all sorts of laws, the so-called Family Relief Act and leave laws and working from home, remote working. There's cybersecurity issues for a lot of people working. And we've tried to incorporate a lot of those powers and authorities into the emergency ordinance, which was drafted and passed by this board some time ago. We've also entered into a regional mutual aid agreement with the counties in our region, Fredericksburg, Stafford, Spotsylvania, Caroline, in order to assist one another as needs may come up with responding to pandemic issues. And also, obviously, there are, as you heard, I think, from Brad Hudson last time, they're going full force there, community development. So we have applications and building permit applications, rezoning, special exceptions, and what have you on that front. Also monitoring the new laws that are coming out. Generally, laws are passed by the General Assembly, go to the governor's, one house or the other, to the House, the Senate, Senate to the House, then it goes to the governor's desk. Governor either signs it, vetoes it. I think he only vetoed one bill this year, or makes amendments to those and then send them back to the House for an up or down vote on the final day, which I believe is April 22nd this year. And so there are a number of laws affecting counties that we monitor and go over those. And I've been in touch with county administrator and the relevant people, whether they be the commissioner of the revenue or the treasurer, what have you. We also looked at the new the problems that may come up with voting. Spoken with the registrar about the things that may be handled there. As you know, the governor has delayed certain things, primaries, elections for cities, things like that, until certain times. So we've been monitoring those. And just, I think that's about it as a general overview of what's been going on the legal front in the county. So I appreciate the time.
Thank you very much, Mr. Britton, and we always appreciate your information, and thank you for the report. Right, next up, hold on, let me bring up my...
Madam Chair?
We have Dr. Young. Do we
Madam
have
Chair?
board Commission's agency reports?
Madam Chair, Mr. Bush would like to be
Madam-
acknowledged.
Madam Chair, I have,
Oh, I'm sorry, Mr. Bush, I didn't see because I was bringing up my agenda. Go ahead.
thank you. I apologize. I do have a question for the county attorney. Mr. Britton, do you have any status report or anything that you could provide to the board regarding the local taxing authority that is currently sitting, waiting for the governor's signature? Is there anything you could provide to this board regarding that matter?
Sorry, I just want to make sure I'm answering the local taxing authority for what?
For example, the cigarette tax, is it?
Yeah, there's a couple of taxations which are before the General Assembly. One of them is a cigarette tax, and the cigarette tax is a tax that localities can impose on cigarette sales within the locality. Interestingly, that has always been for cities and towns. Towns are municipalities located inside of counties, and I guess somebody figured out that if a town can do it, that a county should be able to do it. And so the bill was proposed. There's an identical bill in the House and the Senate that passed. It went to the governor's desk. He had until April the 11th to sign it, veto it, or send back comments. He sent back comments on that bill to the House. So they need to do an up or down vote on whether to accept the governor's comments and send it back to his desk. And what that does is it gives counties the same authority that cities and towns would have on cigarette taxes. There is also a proposed tax. It's a revenue sharing bill relating to solar farms that we're tracking, and we're going to see whether or not that passes. Again, I think that's on the sine die, the last day of the General Assembly on April the 22nd. So I have sent out a couple of reports about the cigarette tax, and I'll let you know what happens on that. We've also met on that, Mr. Bush, with both the county treasurer and the commissioner of the revenue in order to get a head start if that bill were to be passed on how that would be implemented. It's not a simple thing. It requires obtaining stamps, getting those stamps out to the people that sell them, make sure that the correct tax and revenue is collected and brought back into the general fund.
Thank you,
Those
Mr.
are the only
Britton.
two taxation bills that we've been monitoring, or that I've been monitoring anyway.
Thank you. The reason I brought that up, I've done a little legwork on this, and if anybody's a subject matter expert on this subject, it's my colleague, Mr. Stonehill, from back in his days in uniform. But one thing I'm looking at, the town of Colonial Beach has 3 stores that sell cigarettes in that town. Colonial Beach levies a 25-cent tax per pack of cigarettes that are sold in that township. That translates to $80,000 a year into their general fund. Now, I live off of Owens Drive. Just going into the Sheets every morning to get a cup of coffee or to get a soda, whatever I need to wake up, at least 3 people in front of me in line with Maryland tags are buying 4 cartons of cigarettes per person. That's a lot of revenue that is leaving this county, especially when we are facing a recession, when we are making significant cuts to our budget. That's something that needs to be tapped in. I look at it as a double advantage to this county. 1, it brings in much needed revenue, but 2, hopefully this can stamp down this issue we have with smuggling of cigarettes on this 301 corridor. So thank you, Mr. Britton, for that brief. Today's 21st, so if this needs to be passed by tomorrow, the 22nd, hopefully that happens, and I'll look forward to moving forward with this. Thank you very much, sir.
Thank
You're
you,
welcome,
Mr.
and I'll work with Mr. Stonehill. In fact, he and I worked together years ago on some of the BATF raids, and you're quite right. It was a federal issue because when they smuggle cigarettes, unstamped, untaxed cigarettes in and out, there's really no. We aided and assisted in those matters in Joint Task Force, but did not gain any revenue as a result because there was no county taxation. So that's another complicating factor that, of course, we'll work on to make sure when those occur in the federal regulation and federal stamp regulations and raids happen to catch those, that the county also benefits from what's called asset forfeitures when those illegal cigarettes are being trucked over the line, being on the border with Maryland on 301 and the trucks running up and down there. So that's another complicating factor under asset forfeiture that maybe some of the other counties don't have if they're not a border county. So we'll be sure to incorporate that as well. And I'll definitely coordinate with Mr. Stonehill if the bill passes.
Thank you, Mr. Britton. Does anybody else have any questions on? Nope. Well, thank you, Mr. Britton. Dr. Young, do we have any board, commission, agency reports?
No, Madam Chair.
All right, so we move to 414. Any other presentations and reports?
No, Madam Chair.
All right, we'll move to 415, County Administration Landfill Tonnage Host Agreement. Dr. Young.
Thank you, Madam Chair. In accordance with the host agreement established by King George County and Waste Management, the Solid Waste Company has been authorized to accept 1,248,000 tons of waste in the King George County landfill. The host agreement also requires Waste Management to lobby the governing body for authorization to receive any tonnage in excess of the 1,248,000 ceiling as necessary. Over the past 3 years, Waste Management has seen either an increase in business or catastrophic failures of key infrastructure across the Commonwealth. As a result, the company has sought authorization for excess tonnage over the last 3 years. Prior to the current state of our national economy, Waste Management forecasted a sustained need for landfill space to accommodate its business. However, the company finds approving additional landfill space on a case-by-case basis to be unpredictable and not conducive to their ability to plan for future operations. As a result, Waste Management has sent King George County a request to update the host agreement for the landfill. Some basic proposals of the new agreement include increasing the annual tonnage from 1,248,000 tons to 1,800,000 tons. In return for increasing the annual tonnage limit, Waste Management has offered to increase the premium for tonnage in excess of the established $1,248,000 ceiling. The premium for excess tonnage is proposed to increase from 50 cents per ton to 55 cents per ton. We recommend that you authorize the county administrator and county attorney to negotiate and execute an amendment to the host agreement that authorizes tonnage to be increased from 1,248,000 tons to 1,600,000 tons and allow that agreement to expire on December 31st, 2025. I've attached to your board reports the proposed agreement by Waste Management, the landfill tonnage years over the last 9 years, and a forecast detailing how additional tonnage would affect the lifespan of our landfill. In addition, I invited David Howard, the district manager for Waste Management, who also operates the King George County landfill, to speak and entertain any questions or concerns from the board. And I'll now defer to Mr. Howard.
Mr. Howard.
Good evening.
Good evening to you.
I'm really having a little bit of a hard time understanding Neiman over the phone. But did you say that the annual limit would be 1.6 million?
I said that the county staff recommends that we amend the agreement to be increased from 1.248 million tons to 1.6 million tons and put an expiration date on it of December 31st, 2025, or 5 years.
Mr. Howard, did you hear that?
I'm sorry. Is it 1.6 million for 5 years?
That's correct.
Yes.
Okay. Well, unfortunately, that's a little different than we had proposed in the amendment. I don't have the authority to make that change without taking it back to my group.
Well, Mr. Howard, would you like to brief the board just and the public just a minute to about where you reached out to us or give any feedback? We'd just like to have questions from the board.
Sure, absolutely. Yeah. So as we've seen, and I think we've discussed this with most members of the board, we've had a big volume downturn as everyone else has been affected by this pandemic as well. We've seen anywhere from 30 to 40% reduction in volumes across the industry. And with that, we'd just like to have some flexibility to be able to flex back if and when through this long road of recovery, we're able to recover some of these tons, just to be able to flex back, pick up some volume whenever, if and when it's available, and to go from there.
All right. Thank you, Mr. Howard. Ms. Cupp, do you have any questions?
So, Dr. Young, I realize there's a little bit of confusion here. Waste Management came in at 1.8, and you and county staff are recommending 1.6, is how I read the board report.
Yes,
Right.
that's correct, Madam Chair. We did a review of the forecasting and felt that 1.8 may be a much, and we felt that that would have a significant impact on the county's life cycle, especially given if it was to run into perpetuity. And I had a conversation with Mr. Howard on that. And Mr. Howard, I'm sorry, what number did we not? If 1.6 wasn't a number that we thought was doable, can you enlighten me on our conversation and what we thought would be a doable number?
Mr. Howard, did you hear Dr. Young?
Unfortunately, I can hear him, but I really can't make out. Unfortunately, I can't make out exactly what Dr. Young is saying. I can hear him speaking, but I cannot make out what he's saying, unfortunately.
Ma'am, can you pass that message along to him? I thought that we discussed 1.6 was a doable figure for him. If it wasn't 1.6, can he ask him what number did he say was doable? Because we did discuss that 1.8 was pretty challenging.
All right, Mr. Howard. So the question was 1.6. Is that doable or what? How'd you come to the 1.8 number, or those that make the decisions? Like, is there a number that is doable, or is that something you would have to go back and ask your superiors?
Unfortunately, I have to go back and discuss that with my superiors. I mean, I think that 1.6 is probably a number that everyone could certainly work with, but I just don't have the authority to speak on that without taking that back to my superiors.
Thank you. Ms. Kupka, did you have
So-
any other questions? I see your hand up.
Yes, please, Madam Chair, if I could continue. So I guess my hesitation is, this would lock us in until 2025, so that's for 5 years. And I think, Madam Chair, I would recommend that maybe we get at least board consensus now to come up with a number that we, the governing body, would be comfortable with, so that Mr. Howard is very clear and direct on what the governing body's wishes are. Because I got to be honest with you, I'm not even sure I'm comfortable with 1.6, because when I look at the last page of the presentation or the attachment in the packet, the tonnage, the remaining life of site years, I gotta tell you that I would be a little more inclined to look at the 1.472 with the 23 years.
I apologize. I think there's some confusion, because I certainly had some confusion, and I think part of my confusion is the 5-year length of this agreement. Was Mr. Howard, was your understanding that this agreement would be for 5 years, or was your understanding that it would be in perpetuity?
I'm sorry, Mr. Granger. I can't make you out very well either.
Understood.
Could you relay that again for me, please, Madam Chair? Because I can hear you crystal clear.
Yeah, I can help Mr. Granger out and help you out, Mr. Howard. He was asking, do you understand it? Do you understand it previously of it being a 5-year agreement or in perpetuity until the landfill closed?
This was just until the landfill closed. I was not aware of the 5-year constraint as well. Again, these are things that we certainly could probably work through. I didn't know that was on the table right now, honestly.
Okay. Mr. Granger, why don't you ask your question and then I'll relay it to Mr. Howard.
I appreciate that. And I apologize, Ms. Kupka. Okay, thank you. So Mr. Howard provided an Excel spreadsheet to myself. I'd spoken with him about, and I shared with him, my biggest concern was the lifespan of the landfill and the fact that it's revenue source for the county, and long-term planning, making sure that we don't set the county up for a difficult situation down the road. I would assume now that based off what I'm hearing, the Excel spreadsheet he provided to me is showing the impact to the lifespan based on an in perpetuity idea as opposed to a 5-year idea. And if that's the case, my quick off-the-cuff math, if we were to go with a 1.6 million tonnage for 5 years, I believe it would cut off 1.4 years, which would knock it down to 25.7 years of lifespan left for the landfill. Although I wouldn't mind if someone could verify that. I'm just doing it linearly based off of tonnage, which to me seems to make sense, but I could be missing something. And that's assuming that it would see a full 1.6 million tons for the next 5 years and that they hit that capacity. I know that's a lot of information, but I guess the crux of the question is the spreadsheet I'm assuming the spreadsheet he gave to us was showing the lifespan modification based off in perpetuity agreement.
Yes, sir, that's correct. That's a spreadsheet that runs as if it was into perpetuity. And the reason why we kept it intact, because we wanted to include in the packet the exact proposal that was brought to Waste Management, because as you all are aware, the staff doesn't have the authority to basically censor an agreement or offer that's come before the board. So our recommendation is deliberate. We did, number one, suggest 1.6 million tons, because if you look at the history from 2004 and 2019, only one time has Waste Management really exceeded a 1.6 million ton, and that was during the time that the facility in Fairfax realized their catastrophic failure, and King George County's landfill was utilized as the alternative to haul in their trash. As you can see, that anything above $1.6 million is really an anomaly, so it really didn't make sense for us to pursue a 1.8. Number one. Then number two, we recommended a 5-year cap for 2 reasons. Number one, to protect the lifespan of the landfill, like Mr. Granger said. if we did it that way, then it just affect 1 year or 1.5 years off of the life cycle, number one. And number two, thought that is, rather than going into perpetuity, we place the host agreement on a 5-year cycle, just like we do with our CIP process, since our CIP is driven by revenue that's generated from the landfill. We allow for the amendment to run for 5 years, the CIP to run for 5 years, and then once that 5-year term is expired, the future board would actually be in a position to say, hey, well, we understand what our needs are going to be 5 years from now. And yes, it would be beneficial to go ahead and generate more revenue from an amended agreement, or to say, no, we're going to decline and we're returning it back to that 1.248 million ceiling. So it was some deliberate thought into the recommendation that's being brought before the board.
And I'd just like to say I apologize for missing the time span. I completely overlooked it, and so that's my fault, and I think I might have shared that faulty information with some other people. So any confusion, I apologize for, everyone. But thank you, Dr. Young, for clarification.
Thank you, Mr. Granger. Did you have any questions for Mr. Howard directly?
No, I think at this point I have an understanding of I understand what Waste Management's proposal was, and now I thank you, Dr. Young. I appreciate the county's staff's recommendation in far as what they want to negotiate. Thank you.
All right, Mr. Bush, before you ask your question, Mr. Howard, Mr. Granger was just in clarification on what the staff recommendation versus what the original ask from Waste Management was. So Mr. Bush is now asking a question. Mr. Bush.
Thank you, Madam Chair. First off, I'd like to thank Waste Management for their partnership with King George County. I understand, the United States, King George, we're a consumer-based economy. Given everything that's going on right now, there's a lot less consumables. I know we get a lot of trash from New York, New Jersey. With things being closed right now, that translates into less trash coming in. So I can definitely understand what's going on with Waste Management, and thank you for your partnership with us. With that, I do like the idea of not into perpetuity. I like the idea of every 5 years to re-examine. One, I don't want to obligate a future board to decisions that this board may make, and the 5 years does run in line with our CIP process. Unfortunately, the landfill revenues are not going towards what they were initially set aside for. Initially, landfill revenues were to go to cash fund capital projects. That's no longer the case. Landfill revenues are basically managing our debt service. But with that said, we eventually have to get to a point to where we need to wean ourselves off of dependency on the landfill. One thing, King George taxes, when you look at everything and the revenues that the landfill brings in and apply that to our tax rate is artificially low. It's offset by those revenues. If the revenues from the landfill went away, our tax rate would skyrocket. So it's something that we need to understand, that eventually, regardless if that timeline is moved up, if it's extended, those revenues will eventually go away, which is why I'm very happy we have an economic development strategic plan, which we need to see implemented to diversify our economic footprint and bring in alternate revenues. But it also leads me to our previous presenter, which was Mr. Britton, and the questions revolving around the cigarette tax, bringing in those revenues. So eventually we need to look at diversifying how revenues are brought into the county. And Waste Management is presenting that opportunity with this petition. So as far as me, I don't think the 1.8 tonnage is ridiculous. I understand where we're coming at with the 1.6, but I wouldn't have a problem with the 1.8 if, and this is a big if, anything in excess of the 1.2 or whatever the initial agreement is, and then we get the premium for anything in excess of that at 55 cents, if we were to set it at 1.6, but allow for flexibility to the 1.8, which Waste Management has requested, I think we're at a point where we can negotiate. So if we went from 50 to 55 for anything in excess of the 1.2 or 1.25, and county staff is recommending 1.6, and if Waste Management is willing to pay the premium of 55 cents, I would propose, let's make that our policy at 1.6, but give flexibility to the request Waste Management presented and say any not to exceed 1.8, which was their request. We would then get an additional premium instead of 55 cents of 60 cents. So you could go, the current negotiated rate up to 1.6 at 55 is a premium. But if you need to go to that 1.8, then I would like to maybe explore the possibility of renegotiating the premium for that excess tonnage to 60 cents. That's my 2 cents. I don't think it hurts to negotiate. I mean, that's what we're doing here. So that's all I have. Thank you, Madam Chair.
Thank you, Mr. Bush. Mr. Howard, Mr. Bush was giving his thoughts on it and also thanking all of Waste Management for what they do. Mr. Stonehill.
The last page that we got with the remaining life of the site, is that from Waste Management or is that staff?
It's a combination of both, sir. It's working information that we both utilize in our discussions and engagements with Waste Management on a year-to-year basis.
And the line of including the Fairfax outage, what is that?
Again, that was if you look at the previous slide or the previous page, you'll see that the tonnage had exceeded 1.68 million tons. That was the year that the Fairfax facility had caught fire and actually had to close, and King George County landfill was utilized as the alternate site. So we saw a surge of traffic and both a surge of tonnage into the King George County landfill.
Okay, all right, I see that now. My only concern is that, if we're bumping it up to 18, I mean, we're going to lose that many years of the site's life. And as Mr. Bush said, that is a great revenue for the county and keeping its taxes. So I would be very leery of bumping that amount up and shortening that site's lifespan. That's all I have. I mean, that's just a great concern of mine, is just losing that revenue source.
That is showing the lifespan if this award agreement in perpetuity. If we were to adopt a 5-year plan, it would not have as significant of an impact as that data is showing.
Is that correct, Dr. Young?
That's
Are your
correct.
calculations?
That's correct. And with a 5-year span, we expect that it'd be between 1.4, 1.6 years of life lost from the landfill versus 20. I'm sorry, 7.
So I guess our first decision point for my colleagues is, do we want the 5-year or the perpetual? What do you guys feel?
I'm for 5-year.
Ms. Kupka, did you have any other questions? Because I kind of jumped in on your time, and I don't mean to, I apologize, Ms. Bender, but was there something else?
No, I would be willing to do 1.6 at 5 years per staff recommendation at this time.
I agree with that assessment as well.
I'll concur.
Mr. Bush, did you agree with that?
Yes, ma'am, I concurred.
All right, Mr. Stonehill?
I agree with that.
Okay. Dr. Young, Mr. Britt, how would we proceed to just throw it back to 1.6 with the 5 years and renegotiate?
Ms. Binder, I think if I just make a motion, we'll provide them the opportunity to negotiate that agreement with Waste Management, is my understanding. And it sounds like there might need to be a little bit to hash out if that's going to be a doable agreement. But the way the recommendation is, it sounds like we just give them the authorization saying we're willing to do that.
Is that correct, Mr. Britton? Just to clarify.
Yes, if you give county administrator the authority to negotiate with those parameters, I think there are some other issues in there with that would go along with it regarding the quarterly tonnage limits that we had made comments on, and reducing it from perpetual to the 5 year and taking it down from a 50% increase to whatever the other is, from 1.8 to 1.6. So I think that if you give direction that to negotiate an agreement not inconsistent with the board's consensus, then we can go ahead and put that in front of Waste Management, and happy to go add the Amendment 20. There are a couple of other amendments that go into this one that we have reviewed as well. I think there are 12 and 16 that go into it. And so we do have that proposal basically in front of them. So I think you just need to give the direction to county administrator to go forward, not inconsistent with the consensus of the board today.
Okay, so it's just by consensus then?
Okay, I think so. And then the amendment will be brought back, and then he can execute an agreement not inconsistent with this, or if there's a significant deviation, obviously you have to bring it back before the board.
Okay. All right, so we have consensus. Dr. Young?
Thank you, Madam Chair, and thank you, Board.
Mr. Howard, you heard that?
I did not hear Dr. Young. I did hear everyone before him, and that sounds like a good plan.
Okay, thank you, Mr. Howard, and thank you for coming online to talk to us. Sorry you couldn't hear all of us.
Yeah, I'm sorry. Certain people are really clear, and I'm just having a hard time making some others out.
Right.
Yeah, Matt, I'm sorry. Oh, go ahead, Mr. Grange, I'm sorry.
I was just going to bring up, Mr. Britton, I just want to verify, based off the board packet, I got the impression that we would need to make a motion to authorize the negotiation and execution of an amendment. But I'm getting the impression now that you're saying consensus is sufficient. I just want to make sure we don't leave here right now with still needing to make a motion and our official motion and adopt it. Is that correct, Mr. Britton?
Yeah, but given there's two ways to do it. You can, the issue is that there were some other red lines in there in the proposal that we sent forward. So you can either give consensus and bring it back, or make a motion to execute the agreement. But if you want, I was under the understanding that you were giving county administrator the authority to negotiate the agreement, and then you would be bringing it back in its final form to amend the ordinance.
That's fine. I think that makes sense. And so I guess for just the negotiations consensus, and assuming that gets panned out, we would take that at the next board meeting.
Is everybody fine with that? Okay. All right. Well, thank you everyone involved in that. And we'll move now. Is there any discussion items, Dr. Young?
No, Madam Chair.
And then we move to your county administrator's report.
Thank you, Madam Chair. As we are in this current norm, I've invited the the emergency management team, to include our fire chief to come give a board update on the COVID-19 pandemic, and I'm going to defer my time to them. Our apologies, Madam Chair, we're working through some logistics.
It's okay. Gotta be flexible.
Madam Chair, while the presentation's being pulled up, I'd like to go ahead and get started and share with you and the rest of the board some numbers.
Go ahead, that is Moody, right?
That's correct, Madam Chair. Chief Moody.
All right, go ahead, Chief Moody.
Okay, just as a recap from where we have gone to where we're at today. January 21st, the United States of America received its first case of COVID. March the 7th, Virginia received its first case of patient with COVID-19. The numbers updated today, we are just a little over 787,000 cases. Those are cumulative numbers. Those are not cases that are active currently. Those are cumulative numbers from January 21st. But we are over 787,000 cases in the country. That includes over 42,000 deaths. In Virginia, we are 9,630 cases confirmed since March the 7th, with a total of 324 deaths. In the state of Maryland, 14,193 cases with 584 deaths. Within our Rappahannock region, which includes our planning district, 296 cases and a total of 9 deaths. And as you have already mentioned this evening, King George with a total of 19 confirmed cases and 4 deaths. These 4 deaths, as stated earlier, are elderly citizens that lived in our county. So thoughts and prayers are certainly with them, and this certainly hits close to home. With that, we'll go ahead and get started with the presentation. If you can go to the next slide, Chris. All right, just an updated timeline. On April the 2nd, Virginia received its presidential disaster declaration. This was submitted by the governor to the president. The president approved it on April the 2nd. You can go back, Chris. On April the 15th, King George extended its emergency local declaration to May the 15th. On April the 15th, Governor Northam extended Executive Order number 53 to May the 8th. As you know, Executive Order 53 outlines what is essential and what is not essential. And Executive Order 55 goes until June, and that has been more referenced as the stay-at-home order. On April the 17th, we submitted initial cost. This is King George here locally. We submitted initial cost to the Virginia Department of Emergency Management, which ultimately goes to the Federal Emergency Management Agency. One thing that I will mention is that nowhere ever in history has there ever been a situation in which every state, all 50 states in the entire country, have been under an active presidential disaster declaration. Most of these are for hurricanes, catastrophic tornadoes, earthquakes, volcanoes, etc., but nothing where we've actually had all states and territories that have fallen under that disaster declaration. I can assure you that we are covering cost very closely. We are monitoring and tracking expenditures. The expenditures are not like we've seen in other cases where we've had weather-related emergencies, where there's no property damage in a pandemic. There's no generators that need to be repaired or roofs blown off. So this is certainly a different storm in which we're facing, dealing with this COVID-19. Next slide, please. Okay, so this is just a map, and we are providing this information every day to staff and also the public. This is just information we're pulling. Pulling from other resources, particularly the both state departments of health. As stated before, one of certainly the big area that we're tracking is across the bridge going into Charles County. Prince George County is just shy of almost 4,000 cases and probably get there sometime this week. There are some hot spots, certainly in Virginia, but there's also some counties, hundreds of square miles, that they have not had one reported case. A lot of the counties out in the southwest and the central part of the state are, they're 1 case, 2 cases, less than 5 cases. And that is, since this began in March 7th. There is a nursing home facility. Nursing home facilities are a high target area that we are certainly monitoring. The state is monitoring. We are in close working relationship with our Heritage Hall nursing facility, our urgent cares here in the county, and also any of the residential population that fit into the high risk categories. We're certainly monitoring all those situations. But in Rico County, you can see in Rico, City of Richmond, Chesterfield, that area, they have experienced a nursing facility that almost was a pretty large chunk of the deaths that were reported was from that one nursing facility in the Richmond metro area. If you go to, as of today, I've had a question that came up earlier that said, well, when you go to King George on Virginia Department of Health's website, it says 2 deaths, reporting 2 deaths for King George. The answer is that there's 4 deaths, and that's the true factual answer. We have 4 deaths reported, and there is some lag between what is being reported through Virginia Department of Health regionally and then what's being reported on the state's website. So, next slide, please. Okay, certainly can't go without mentioning our community outreach and partners that have folks that have just come together throughout our King George family and that have been looking to help. We've had folks, the churches have been looking for opportunities to assist and to help. We've had donations from various organizations to the fire rescue. Also, I believe the sheriff's office has received some donations. But I wanted to just we just put a few pictures on here. In the top left, that is Five Guys. Five Guys contacted us and wanted to provide lunch, and we didn't turn them down. IHOP provided some pancakes there. The picture there in the middle, we had a lady and one of our volunteers actually made close to 100 cloth masks for us. And then at the bottom is the King George Village Quilters. And they use our Dahlgren Station 2 for some of their events. And they made us almost just shy of 200 masks. So we have been very fortunate. On the other side there, Dickey's Barbecue has provided us even provided some lunch and stuff. We received a $600 donation from the Leedstown Daughters of American Revolution, and just people that are just outreaching and really showing their support for the first responders in certainly a time of need. It's a stressful time. I will tell you that our folks on a routine and daily basis are responding to calls that either the patient has a fever, the patient has difficulty breathing, shortness of breath, and just any of the symptoms. Travel history's out, but any of the symptoms that that may be suspected of COVID-19, our folks are having to put N95, goggles, isolation gown, and certainly gloves. And there's as you can imagine, we can go through quite a bit of that as we're responding to the needs of the public. Next slide, please. Okay, at this point, I'm going to turn the rest of the presentation over to Chief Lynn, and then we'll answer any questions you have at the end.
Good evening, everyone. I have this slide up here are 4 emphasis on how the county is preparing and responding to COVID-19. Our public information, we'll talk about that in a second. Obviously, maintaining the government services, our public safety, involving 911 operators, fire and rescue, and law enforcement, and emergency management now, where we're working on ordering supplies and tracking our costs and beginning the next phase of this operation. Next slide, please. Just some recent EOC actions that we've taken since our last time we were here to brief you. The GIS office developed a new public information hub, and we'll show a couple screenshots of that here in a few minutes. Chief Simmons has provided updated COVID-19 training to all of our career staff and volunteer fire and EMS providers, just to do some just-in-time training and reemphasize what they've learned and wearing the PPE and all that, so our providers are educated and protected. We've purchased thermometers. As you saw tonight, we're doing temperature scans. That's a best practice in the industry, and we're doing that at fire and rescue stations. Here, Sheriff's Office is doing it at the Sheriff's Office and also at the courts in order to keep the public safe and also to keep the employees safe. We're providing PPE to some of the county departments that need it, extra cleaning supplies and all that. We're managing the bulk of it here in the Emergency Management Office. We're trying to collect as much as we can. We have some of that stuff being donated to us. Some of the businesses that aren't using their N95 masks and stuff like that are donating that extra supply to us, which is very helpful and helping us to stretch our supplies. We're also working on ordering additional PPE. We're still working with the Northern Virginia group to make a purchase of N95 masks. We did make a purchase of face shields with the Northern Virginia group, and we just took delivery on those today. So that was a good way to leverage a large purchase to get it to a supplier, and they can return the product fairly quickly, as opposed to each locality going out and trying to buy a small batch at a time. And we're tracking the COVID-19 expenses. I'd say that finance has set up a really good method to track it. When this thing started early, we talked about how the best way to track it is, and that's working for us. When I went to submit our first report, everything I needed was located in one folder, and with the copies of the invoices and the costs and all that stuff. So that made it really easy for us. And as this thing goes forward, and then with the recovery process, providing all the documentation is going to be hopefully really easy now. Next slide, please.
Chief, if I may, go back. So just for me to expound upon that just a little bit more, when he's referencing providing PPE to other county departments, you'll see that the Fire and Rescue Department, specifically the Emergency Management Operations Center, has done a good job of ensuring that departments like General Properties, they actually had to be masked up. And as you all are aware, we had a scare at one point that there may have been a contamination in the building. They were called in, provided the PPE to clean up the office, and that was afforded to them by the EOC. If you go by the convenience centers, you'll see that we have our employees in the convenience centers with masks and PPE on as well. And that was, again, supplies that was afforded by the Emergency Operations Center. So we appreciate you all not only taking care of our community, but taking care of the county staff as well. I spoke with Chief Lynn about the COVID-19 expense tracking. I know that's a joint effort between the Finance Department and the Emergency Operations Center. And I'm actually the same question that I did at the huddle, Chief. If you'll let the board know, put a number to that. Where do we currently stand with our expenses as a result of the COVID-19 pandemic?
Okay. Roughly, we have about $12,000 worth of expenses and extra PPE that's ordered, extra cleaning supplies that's ordered. General Properties had some additional costs and cleaning supplies and a little bit of overtime for the cleaning process. We're still tracking it. FEMA's rules are changing. So what's going to be eligible at the end of the day is still up for, the interpretation of the rules. But we're tracking everything. And, when they say this is eligible, we'll have that documentation for it. Any other questions?
No, they're good.
Next slide, please. So this is the new information hub. The GIS office put this together, and this is on the county website. It's a one-stop shop for all kinds of information the citizens would need to know about the county's response to COVID-19. It shows, the documents, the emergency declaration, other public releases the county's put out, all that there, so they can click on it and download it. If you scroll down just a little bit, this is a screenshot, so you can't. It talks about our hotline, and it also talks about the to-go meal program the schools are doing. So one-stop shop where the county can get information. Next slide, please. This is part of that. This is a new dashboard. This is data-driven through the GIS office. And the nice thing about this is it automatically updates when the new information is pushed out to the web. How GIS works, that data is pulled down and it's captured right here. Yes, sir.
So I have a question on this slide.
Yes.
King George case is 18. King George deaths, 4.
Yes.
So we know that the numbers that are being recorded for King George is cumulative from the first identified case, which, given the time frame, that person probably doesn't have COVID anymore, my opinion. But all that aside, the 4 deaths, are those 4 numbers built into the 18 for King George cases?
Yes. Yes.
So even though they're deceased, they still count as cases.
Yes. Yes.
That's ridiculous. I know it's not you. So thank y'all for all your efforts. And again, I would like to stress, I know the Virginia Department of Health does not like using the word recoveries for some reason. However, is there a way to get a damn answer from them on what are the active cases in King George County?
Sir, we asked them that question. We asked them about recoveries. We asked them about, hey, could you provide us if they were COVID-19 related, which they believe that the deaths are. We have asked them for a defined definition on what is recovery and why are these cumulative cases not decreasing. And they have not given us a definition. And we decided that we were going to maintain the same numbers that the Department of Health is showing. So we wouldn't show any confusion or put ourselves into any potential exposure for us to say, yeah, this person is recovered because by our own definition here in King George County, but in reality, the person actually is not recovered by the state's standards. So we continue to peg them. I know that Chief Lynn has talked with the EOC and their public affairs office, and I personally talked with the director of the Rappahannock Area Health District on 2 separate occasions, explaining that need for recovery numbers and to give us some comprehensive guidance on how we can define recovery rates and communicate that to the community. We're still waiting on a response from the health department on that, and we know that's an important data point for not only the Board of Supervisors, but for the county as well.
And I can absolutely appreciate that. And I would not want you guys making a decision on what you're gonna put out there or what you're not. I mean, there needs to be a standard. So I could definitely appreciate what you're doing, okay? My critique is not of you transferring information, but the information you're putting out there is only as good as the information you are receiving. My issue is with who you are receiving the information from. I have a problem that we cannot get a straight answer, not from you, but from the Virginia Department of Health, how many active cases exist in King George County today, and we can't get a damn answer. That's what I have a problem with. My issue is not with you. Thank you for everything you do. My issue is with the Virginia Department of Health. Maybe this isn't the appropriate place to discuss that, but I have a damn problem with them. Thank you.
Dr. Young, is there one of the responses back is privacy concerns?
I don't think that this is an issue of privacy concerns, ma'am. Actually, I think it's a matter of undermanning. Personally, I think that from what I've heard about the staffing at the Rappahannock Area Health District, I've heard that they're overcome by data versus having that manpower that they need to actually be able to synthesize information and give us the relevant data that we need to convey to the general public. Once, as you all are aware, they were able to take the reporting out of the health district's hands. They turned it over to the Department of Health because of their undermanning and being overwhelmed by that data. And as a result of that, they was able to focus more on notifications and communicating with the general public. And I think that Chief Moody, Chief Lynn, and myself can tell you all that we have seen a more robust reporting coming out of the Department of Health since they decided to make that move. I think that as they start getting their footing and actually placing more manning at the health districts, we will see more robust information. Hopefully we will see that relevant data that we need for King George County, specifically recovery rates and how this pandemic is affecting our community, not cumulative, but on a case-by-case basis.
Madam Chair, may I?
So I guess, yes, Ms. Cup, I was just going to make a comment though before that. So they are data overload, basically, Dr. Young?
I think that's a good way to put it, ma'am. Yes, ma'am.
Thank you. Ms. Kupka, sorry to interrupt you, but go ahead, Ms. Kupka.
That's okay. Thank you, Madam Chair. So the bottom line here, though, realistically, is we're not going to get the answer you want, Mr. Bush, because the definition of recovered, quite frankly, varies from person to person. So what you may be recovered, what you may call recovered for you, for your body, for your lifestyle, is probably going to be dramatically different for someone younger and someone older. So there just, to me, is really not going to be a quantifiable way to measure that. And that's why I shared in my board report the information about hospitalizations. And so if the local health district is not able to give us the data that we want, because there just isn't a quantifiable way of measuring recoveries, and they frankly are overwhelmed with data, then all we can do is the best that we can, and you all are certainly doing that. You're making every effort to get information out to the community. I noticed the new hub, the information hub on Friday night, and immediately shared it with the community. And like you said today, saw people on social media saying, well, the Virginia Department of Health website says we only have 2, but the county COVID dashboard says, we have 4. So we, the county, are being as transparent as possible and making every effort to put out the information as soon as it is conveyed to Dr. Young and the EOC. So everyone, please know that. I had another question, but I'll let you continue and maybe it'll come back to me.
Okay.
Thank you.
And this dashboard right here, just like this, is available on the county website. You just got to go to the county website, go down and click on the link, and it'll load on your device just like this. And it's got the map, and it shows each locality's numbers. The graph at the bottom, the blue is Maryland, and the red is Virginia counties. Next slide, please. Just wanted to put this slide back in there and talk about public messaging. Obviously, the county website, our KG alert system, and also our Facebook page, and also the sheriff's office Facebook page, where anytime we have a message to push out, we try to hit all those platforms so the citizens can get the information. They don't just have to rely on one source to get their information. Next slide, please. Just to review the actions that's been mentioned before, that citizens can take: social distancing, washing your hands, covering your cough. If you have a fever, stay home, avoid large crowds, limit non-essential travel, and always follow official information about the best way to keep you and your family safe. Next slide. The addresses for the websites have been mentioned. Our Facebook page, King George Fire. Next slide. Any questions?
Do we have any questions? Not a great EOC.
Madam Chair, I did remember my question, if I may.
Go right ahead.
So I know the health district isn't able to be too specific with regard to the data about the victims and the positive tests, but are they able, and I am not saying I want to see this on your GIS map by any means because it's confidential. We need to protect people's health information. But do they provide you all with address data that you all can use first to make sure you're aware of special considerations you need to take as far as PPE and so forth? And then secondly, I noted in the newspaper, I think it said something about our Rappahannock Health District is the only district in the state that doesn't have a defined outbreak yet. But, and this might in part answer Ms. Dyson's question at the beginning. She noted that we have 4 deaths and there are only 9 in the whole district. Are you all doing anything behind the scenes quietly to kind of map where the cases are so that if we were able to on our own identify where there might be a small cluster or anything like that? I mean, do any of these people have anything in common like that that we could track?
To answer your question, yes, we do get the address data, and we are, using that internally to protect the public safety responders. And we have looked at some of the data, and we've, anytime the health districts ask for any kind of local comments about what we see in the community, we've given that back to them. We're, as the chief talked about with the nursing homes, that's a big emphasis watching the nursing homes because, anytime you get a population that in a tight area, something like this could spread.
Thank you very much.
Thank you. Mr. Granger?
Yeah, thank you so much, guys, for coming out and briefing us. I appreciate the information, and I appreciate all your efforts, and all your staff does. So thank you for keeping us safe. I know last time I'd asked some questions about calls for more traditional, I guess what fire and rescue and EMS traditionally respond to. And you said it was still pretty early. I didn't know if you guys have any further data. Do calls seem up? Do calls seem down? Aside from obviously the virus or the pandemic issues that we're facing.
We've seen it seems like this week or the past since last week, and especially since we have provided a briefing, that there's been a little bit more of an uptick in calls.
Okay.
Just in the couple I guess more high priority calls we've had since the last time we've come to this board and we've had a meeting.
Mm-hmm.
We've had 2 structure fires. We had a shooting this weekend. Accidental shooting. Mm. We've had overdoses and car crashes. Seem like they have been certainly have declined. However, we still are getting those. It doesn't seem like the volume of that. But as far as actual numbers, I don't have the numbers per se. I know in your board report was tracking. I think we came in last month, which is still kind of hard to capture that data and do something with it. We were a little less than the previous year. Mm-hmm. It's going to be interesting to see what overall the total month of April is going to bring, and what the month of May will bring, and then how long we're still dealing with COVID-19 as a very critical factor in our community. But we're still running these high priority calls, and people still have other medical emergencies. They have heart attacks and strokes and diabetic emergencies and COPD and everything. We're still delivering babies out in the field, and none of that goes away. And that's kind of the important thing to remember, is that we still have that. We had one of the house fires was in Fairview Beach this Easter Sunday, And just ironically, we just got off another fire right before that in Oakland Park subdivision in the western part of the county. So, we're still in wildfire season until the end of this month. But those calls continue. So,
Thank you.
Mr. Stonehill, did you have anything?
Yeah, Chiefs, I just wanted to say, I just had to find my mic. Chiefs, I just wanted to say thanks for your all's continuous work on all this. But isn't there somewhere there's some info on who tests positive and when they're released from isolation? I've heard that maybe Maryland has that information and shows, when folks get released from isolation. Do we not have that here in Virginia at all?
So Supervisor Stonehill, that you are correct about that. The state of Maryland is providing what they term as a release of from isolation case numbers. In Virginia, we're not getting that information there. I don't. I know Ms. Kupka, you mentioned something earlier, but I can tell you we're not getting that information readily available, at least, and we're not. We are getting some information from the Rappahannock Area Health District when it comes to our cases locally. For example, sometimes we don't get the names of let's say the deceased, but then they come off the list and we can kind of connect the dots, so to speak. But Virginia is not tracking, at least providing it for public information, the release from isolation cases.
That would be nice to know, but as Mrs. Kupka said, that when I recover may be different from when you recover, but at least we'd have some type of info. But I mean, if that's not provided to us, that's just unfortunate. And I know that you guys are busy. I'm hearing sirens running every which way. So thank you again.
Yeah, I want to reiterate, thank you. I was part of the first 3 training sessions for our EOC that we took in the last 2 years, and it's amazing the good work that was put into planning those sessions, and now it's put into practice, and you guys are going above and beyond what we practiced in those 3 training sessions. So I want to personally thank you as someone who was there with Dr. Young at those training sessions. Thank you for all you're doing, and especially to our great GIS again for providing that data. Mr. Bush, you got a question? Go ahead.
Thank you, Madam Chair. So in my previous comments, I didn't get a chance to, or I neglected to give you my appreciation. Thank you for all that you're doing, and I know it's not comfortable facing all these questions, especially from somebody who wants some answers like me that just can't get those answers. But to everything y'all are doing, thank you very much, especially with the fire regarding Fairview Beach on Easter Sunday in the heart of my district. You were very thorough, providing a lot of information to me, to the citizens down there, and to Mr. Bennett, who is the Residents Association president. Thank you very much. The last thing I'd like to close with is I understand that recoveries are a matter of perspective. What recovered to me isn't necessarily the same. Ms. Kupka is absolutely correct. But if they're recording those through a test and someone tests positive and that's how they're recording that affirmative number, you should be able to test or find out when that person no longer has it. That's a definitive. And there are ways, if they wanted to provide those numbers, they could, and they are not. That is not a matter of perspective. If a lab test result says I'm positive, there's a lab test result that could say you are negative. And that's all I have. Thank you.
And, Madam Chair,
Thank
if I could just mention that certainly myself, Dr. Young, Chief Lynn, Mr. Britton, we have all had some pretty stern, candid conversations about the information sharing on what is being provided to us. We are certainly recipients on the public safety side that says, hey, we need this. We want certain type of information. There have been some long strides since this first kicked off at the beginning of March to where we're at today. Certainly, we'd like to have a little more, but I will say this: that when it comes to the active cases of COVID in every community, this is only going to become more important as time goes on. And the first month, you can work in cumulative numbers, and we need to track cumulative numbers. We need to do that. But we also have to, as the numbers continue to increase, it is inherently important that we know, well, how many do we have today when we're talking maybe in the fall? Okay? So as time goes on, this becomes inherently more important. And, I can assure you that if we get the word from BDH or RAHD that they're going to start providing us some more refined data points on active cases, not even using the word or terminology of recovery, but active cases, meaning those people that are isolated and that are active with COVID, then I can assure you that Dr. Young will be aware of that. This board will be aware of it. And I could only hope that VDH would present that to the public for transparency purposes. That's all I want to say. Thank you.
Thank you. Dr. Young?
Nothing else, Madam Chair.
Do you have anything else in your board report?
No, Madam Chair.
All right, with that said, hold on a second. Did we have any information items? And we have a motion for adjournment.
Move to adjourn until April 27th at 6 p.m.
Second.
You're always the adjourn guy.
Dr. Young, 1 second before we finish that motion, on our board packet, it has adjourned to May 5th. Are we still doing the work session
Yes, ma'am.
on April 27th?
April 27th,
Okay,
ma'am.
right,
Roger.
that's my discussion item. All those in favor?
Aye.
Aye.
Any nays? Chair votes aye. We are adjourned. Thank you, everyone who joined us on the GoToMeeting, and everyone stay safe and go King George. Thank you.